How's it going, guys? We have a difficult question for neuro for step 1 and step 2. This question, not only does it show up on the current online nbme forms for step 1, but it's also on the retired offline forms. It's a repeat question. So if you think this is weird, don't take it up with me, take it up with the nbme exam. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, I really appreciate it. Find me on Instagram at Mehlman_medical, mehlman_medical, links down below. Find me on Telegram, links to the Telegram group and channel down below. Now start the clip. So 40-year-old woman to a history of worsening balance and dizziness. She reports a mild decrease in appetite and nausea. Her brother has multiple sclerosis. Physical exam shows a mid-systolic blood pressure 135/85. Light reflexes distorted. There are no motor or sensory abnormalities. Reflexes are normal. Which the following is most likely explanation for these findings? So let's just whip through the answer choice here. We'll go backwards. Choice E, stroke, wrong fucking answer. So look, the biggest risk factor for stroke that you unequivocally need to know for USMLE is hypertension. Okay, so they love that across family medicine, IM, especially for 2CK, where smoking cessation is a very frequent answer for how to decrease morbidity, mortality in a variety of scenarios. But for stroke, it's hypertension. All right, so this patient doesn't have high blood pressure. So atrial fibrillation and hypertension causing carotid stenosis, atherosclerosis, those are the two things you look for in a patient who has potential stroke or who has had a TIA, stroke, or retinal artery occlusion. Wrong fucking answer. Choice D, multiple sclerosis. Wrong answer. Okay, so as I prefaced with, don't take it up with me if you think this is weird. Yes, the nbme question, they choose to be fucking assholes, and they say the sibling has MS, and they even tell you the light reflex is distorted. You say, well, that's really weird. What's going on here? I agree with you, because in MS, we can get optic neuritis, okay? So inflammation of cranial nerve 2. We can get a relative afferent pupillary defect. That's a Marcus Gunn pupil. We can also get MLF syndrome, medial longitudinal fascicular syndrome, internuclear ophthalmoplegia. So we can get eye findings with MS, which we have here, but it's the wrong fucking answer, okay? So we'll continue to move through the question and I'll explain things. Choice C, Meniere disease, wrong answer. Albeit this does show up a few times on the neuro assessments, mainly 2CK. So you just need to know this is a familial disorder. There's no strict inheritance, but they'll just give you a subacute to chronic history. So many months to years, okay? And they'll say that there's asymmetric tinnitus, vertigo that waxes and wanes over time in a patient, and there may or may not be other family members who are affected, okay? That's Meniere disease. You can attempt antihistamines in these patients. This is due to defective endolymphatic drainage. Wrong fucking answer. Choice B, labyrinthitis, is the correct answer, okay? So this is going to be, on USMLE, a viral infection followed by vertigo and or tinnitus. All right, now we have what seems to be a viral infection. The actual nbme question is harder than the one I just wrote because they give you a big fucking rambling paragraph with other extraneous details. I more or less just cut to the chase. So it's a viral infection. That's what this first line is attempting to convey to us. And then you've got what appears to just be dizziness and vertigo. That's labyrinthitis. You say, well, what about vestibular neuritis? It's pretty much the same. I mean, we can speculate that OMG, labyrinthitis could have tinnitus, vestibular neuritis doesn't. I mean, the answer here is labyrinthitis, same as the nbme question. There's no tinnitus in that stem. And you say, well, what about the light eye reflex? The light reflex, though, that's when you shine a light in the eye, cranial nerve 2, and then you get a distorted response with cranial nerve 3, oculomotor nerve coming back. You say, why in the world would that be distorted in labyrinthitis? I agree with you, okay? And before even writing this question for the YouTube here, I double checked on Google, typed in labyrinthitis, light reflex, okay? Did a bunch of reading on it. For whatever fucking reason, there's no real explanation. Sometimes the eyes can get fucked up in labyrinthitis, all right? So as I prefaced with, it's a difficult question because they throw all this MS stuff in here as a distractor, but it's wrong. You need to know labyrinthitis / vestibular neuritis on USMLE is going to be viral infection followed by vertigo and or tinnitus, and you can occasionally get eye findings. If they wanted MS, presumably they're not going to give you the viral infection as a salient point in the stem. Okay, they might give you a relapsing, remitting type of presentation. And they might give you sensory/motor abnormalities. Okay, things like clonus, Babinski sign, maybe urge incontinence. You get other types of findings in MS classically. And labyrinthitis/vestibular neuritis, it's self-limiting. Okay, corticosteroids, antihistamines can occasionally be attempted. There's no true significance. I haven't, in terms of their ability to treat, I haven't seen the management assessed on nbme questions either. Okay, so they just simply want this diagnosis, as in this case. Real quick, bppv. This is just going to, if this is the answer, benign paroxysmal positional vertigo, they're just going to tell you patient gets miscellaneous episodes of the room is spinning for 30 seconds, often with vomiting, and you can diagnose with what's called the Dix-Hallpike maneuver and treat with the Epley maneuver. They might just tell you when the patient is quickly positioned more supine and neck is turned and we get a reproduction of symptoms, they're just telling you that's the Dix-Hallpike maneuver for diagnosis, and that's bppv. Okay, it's not a high yield diagnosis. You just need to be aware of it. Okay, wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. And I appreciate your time. That's it.